This is the Health Matters program produced by the Ministry of Health. I'm your host, Alicia Martin. Today we'll be focusing on the arboviral disease dengue, and joining me on the program is Dr. Reason Niles, the Acting Director of the Vector Control Services. Welcome to the program, Dr. Niles.
Thank you for having me, Alicia.
So today we're going to focus on dengue, and with dengue being endemic in Latin America and the Caribbean region, we want to talk a little bit about it. For those persons who still don't have the right information about it, could you tell us what is dengue?
Okay, that's an excellent question. Dengue, it's a viral disease. So it's a viral disease. And this disease is really transmitted by an infected Aedes aegypti mosquito in some cases, but really by the genus Aedes mosquito. Dengue happens to have 4 serotypes, or 4 types of viruses. So dengue V1, V2, V3, and V4. When you're bitten and infected with one serotype, in reality, you can have lifelong immunity to this particular serotype, for example, serotype 1. But that does not mean that you'd have immunity to the other serotypes. So potentially a person could be infected about 4 times in their life if there are 4 serotypes circulating. So what we'd advise, that's why one of the things we push is to avoid being bitten. Once you're not bitten, you're not infected. But if you are, you can have lifelong immunity. However, what we're seeing is a lot of severe cases. So we're advocating that persons avoid being bitten, that they take the necessary precautions, make sure that their doors are closed at a certain time, make sure there are no mosquitoes in the home and no mosquitoes outdoor near the home. So this disease, of course, normally starts, as we would know classically, with a fever. You have a high fever. You can sometimes have pain behind the eyes. You can have joint pain, muscle pain, and a couple other symptoms. But what you should do, once you feel these symptoms, we'd advise you to go to the hospital so at least you can be evaluated. But as you rightfully said, dengue right now, we see it in a lot of countries, in Latin America, in the Caribbean, and of course in Guyana.
Definitely. Is it possible for someone to have dengue but not experience any of the symptoms that you would have mentioned?
Very correct. Actually, dengue, it's more common to have people that are asymptomatic, which means they have no symptoms. So they probably don't even know they're infected. So that's quite common.
In those cases, what can be done? I guess it's kind of difficult to for them to receive treatment since they're showing no signs and they're showing no symptoms. But is it possible for them to fall severely ill after a long period of time since they haven't been experiencing any of the symptoms in the early stages?
Actually, that's quite unusual, but should it occur, the minute the person notices that they have signs and symptoms, you go right away to your doctor. That doctor will make the necessary patient evaluation and decide to escalate or not, or probably tell you need some rest or hydration. But it's really unlikely for persons that are asymptomatic to become severe, but in the likelihood that it happens, seek care urgently.
Definitely. For persons who are caring for probably a family member or even a friend who may have had or who may have dengue right now, what advice do you have for them, or even tips as they care for that person?
Well, first of all, before you start caring for the person, I prefer that you go to your medical practitioner just to make sure that the patient is okay, that your family member and loved one is stable.
Yes.
And if the doctor requests that you stay at home for whatever time, what we simply say is some preventative things you would need to do. Make sure that there are shades, mesh in the home, as we would call it in Guyana, on the windows and on the doors. Sleep under a mosquito net. Wear some long sleeve clothing, because during the first week of infection, possibly the person, if a mosquito, the Aedes mosquito specifically bites them, they can also contribute to the transmission of the disease to the other family members. So they can even have the insect repellents, spray their body, spray their clothes, and that could reduce the contact with the mosquito to reduce the biting.
So Dr. Niles, you mentioned the Aedes aegypti mosquito. How can we prevent the bite? I know that is the most important question out there. So in order to prevent dengue, we have to ensure that we prevent that bite. How can we do this effectively?
Well, that is the question of the hour. So really and truly with dengue, the principal action we can do is vector control. There's personal care, and I'll start with that aspect. Normally, we advise that persons wear long sleeve clothing so that the mosquito, so there's reduced skin exposure for the mosquito to bite. We ask that you use repellents where possible, and we advise repellents that are recommended by EPA or CDC so that there's no irritation. We also recommend that these persons have the mesh up on their windows. We ask that they have the mesh up on their doors. These mosquitoes are actually called day-biting mosquitoes. So we ask that, you make sure the home has no place that the mosquitoes can dwell, because they like dark and cool areas, and even around the house. So that's inside the house, but not outside the house. I would advise people take 10 minutes. Go outside in your yard, in the environment, and look at what you can do. Is there any container that could potentially hold water? Discard of it or top it over and, store it appropriately in tires, flower pots. Anything that could potentially hold water is a potential breeding site for a mosquito. So what we're trying to do by doing that, we reduce the mosquito from having a place to lay their eggs and create more mosquitoes, which would probably mean more biting. So that's what you could do. So if you have trash accumulated, get rid of that trash. If you have receptacles that need to be thrown away or stored appropriately, do that. And that could take 10 minutes every week.
Definitely. I really do believe it's a collaborative effort, and I think that community members should join in. Neighbors should join neighbors and, get this done.
Exactly.
Even the tanks, the water tanks, too, is another breeding site. Yeah. And so when we talk about breeding site, that's also an important aspect. Cleaning those tanks, even our roof gutters.
Exactly.
That is also important that we keep those clean as well.
Our drains.
The drains.
Yeah. Keep everything covered where possible. And if you can't keep it covered completely, you can put a very fine mesh that is least smaller than the size of a mosquito, so that the mosquito can't come and lay on that surface where there's water.
And then there are many, in many communities, there's stagnant water.
Yeah.
And so I know that that is something that needs to be sorted out. And from the community level, it can be done as well.
Yeah, and then you can probably do your part in front of your house. That's the least we do. If everyone caters for their part, we'll be doing a lot together.
Definitely. I know the Ministry of Health has been doing a lot of fogging in various areas. Could you tell us about that experience? How have persons been responding to the fogging exercise? Yeah,
so the Vector Control Services Department, it's a program within Program 2 within the Ministry of Health. Normally, we have 3 sub-programs within vector control. We look at the malaria department, the dengue or the Aedes department as we call it, and the neglected infectious disease department. Of the moment, we are speaking of the Aedes department, and here is where we principally do a lot of the fogging comes under this part. And fogging is actually a form of adulticiding, and that simply is a big word to say we're trying to kill the adult mosquito, because it's the adult mosquito that does the biting and does the transmission. However, the fogging is one component of many. Just like we said, you could do your part at home. Along with the fogging, these are complementary. So when they're done together and continually, the impact is high. So the fogging exercise is currently ongoing in all the regions. A lot of collaborative efforts have been done, and I know a lot of people are already seeing them in the streets. All we ask is that you be very receptive to them. They're doing their job. We ask that you treat them with kindness when you see them, because I know that some people, they do have 1 and 2 complaints, and we're trying to address them all. But we also ask that you collaborate with the programs, so that when you see them fogging, you cheer them on, you open your windows, you prepare, you move people who may have breathing issues or disorders, such as asthma, for example. You just move them away from the area so that they don't breathe in the smoke. Those are some of the few simple things. But I'd also advise that they look on the Ministry of Health page. We normally put up a fogging advisory.
Yes. Thank you, Dr. Niles.
You're welcome.
6 things you should know about dengue. Dengue is a viral disease that, if left untreated, can be fatal in a matter of hours. Dengue virus is transmitted by the Aedes aegypti mosquito. This is the same vector that transmits Zika and chikungunya. If you experience fever, headache, muscle pain, rash, nausea, or vomiting, do not self-medicate. Visit your nearest health service immediately. Dengue can be confused with other diseases, so diagnosis must be made in a health center or hospital. To prevent dengue, you should protect yourself from mosquito bites. And to prevent bites, eliminate mosquito breeding sites. Visit our website for more information.
Dengue is a flu-like illness spread by the bite of an Aedes mosquito infected with the dengue virus. The Aedes mosquito can breed even in a small amount of water accumulated in any container-like object. Drain out and scrub clean garden fountains, bird baths, and flower pot base plates at least once a week. Turn over or cover objects that can collect water, such as wheelbarrows, drums, or bowls. Cover overhead water tanks with a tight lid to prevent mosquitoes from entering. Cover the overflow pipes of water tanks with a material that allows water to flow out, but prevents mosquitoes from entering. Clean roof gutters by ensuring the outlet remains open and water does not stagnate. Ensure bottles, plastic containers, or any other discarded material in which water can collect are properly disposed of or recycled. At least once a week, drain out and scrub clean trays under refrigerators, air conditioners, water cooler tanks, indoor flower pots, and vases. While spraying insecticides to kill mosquitoes, focus on dark areas such as closets, underneath beds, and behind curtains. Leave the doors and windows of your house open when local authorities are carrying out fogging. Dengue is a flu-like illness spread by the bite of an Aedes mosquito infected with the dengue virus. Aedes mosquitoes bite through the day. Biting intensity is highest 2 hours after sunrise and 2 hours before sunset. Apply insect repellent throughout the day. Use household insecticide, aerosol, mosquito coils, and vaporizers. Sleep under a mosquito net even during the day. Use screens on windows and doors to stop mosquitoes from entering. Wear long-sleeved and light-colored clothes. Prevent mosquito breeding in and around your home, your workplace, and even public places. Dengue can and must be prevented.
So with dengue as the most common arboviral disease, could you tell us of some of the symptoms of dengue? What can persons look for? What are the signs?
Well, there is joint pains, headache, fever, rashes.
Okay, with regards to dengue, what treatment is available?
Well, when we speak about dengue, there isn't a specific cure for dengue. However, they do treat according to symptoms. If you have pains, they would give you Panadol and etc.
Thank you, Ms. Bowman.
You're welcome.
A mosquito breeding site can be as big as a barrel or as small as this container. This is why it is very important to eliminate mosquito breeding sites in and around the home. Wash and change the water in containers at least every 7 days. If you have water barrels, remember to keep them well covered and wash with soap at least every 7 days. If you live in an area where there are many mosquitoes, protect doors and windows with mosquito nets. Turn containers that can accumulate water upside down and eliminate those that cannot be used. Keep trash bins well covered and free from water. Clean gutters and drains to avoid accumulating garbage and water. Share this information with your neighbors so that the entire community works to eliminate breeding sites and prevent dengue. Remember, check, wash, cover, flip, and eliminate. What you should know about the mosquito that transmits dengue. This mosquito is called Aedes aegypti and lives in most countries of the Americas. During the rainy season, it appears in our houses and surrounding areas. It likes to bite at sunrise and sunset. It is a mosquito that prefers cool, dark areas of the home. The female mosquito reproduces every 6 to 7 days and lays her eggs in clean water. Therefore, avoid keeping any containers that accumulate water in your home or yard. Without breeding sites, there's no mosquitoes. And without mosquitoes, there's no dengue.
So, Dr. Niles, there's also a larvicidin exercise. Could you tell us about that and how it works?
Well, larvicidin complements the adulticidin or the fogging that we mentioned, or one aspect of the adulticidin. The larvicidin actually speaks about indoor residual spraying, outdoor residual spraying, and even the application of Thermophos or Abates to certain bodies of water where potentially mosquitoes can breed. Normally, some people may be aware, they might see persons coming when they inspect your houses, and if there are potential breeding sites there, they would apply a bait so that we can potentially kill the larva. That's the aim, is to kill the larva. And once we do that, we actually call that entire exercise larva source management, because we're trying to reduce the larva population so that it doesn't become an adult mosquito that would bite us. So we have that ongoing, and a lot of people might see them in the communities walking by, just receive them. They're just inspecting, and only with your permission we can empty your homes. So it really is a collaborative effort.
Okay, I know you guys have been collaborating with the Environmental Health Unit. Could you tell us how that has been going as well, and some of the work that you guys have done together?
Yeah, we need to extend a lot of thanks to our environmental health colleagues, our partners, our sister program. The environmental health, they have been out in the fields with us. Some of them even participate in fogging in various regions where there's no vector control personnel, or at least there's not enough personnel, so the environmental persons participate. An environmental health officer, I don't want to take too much liberty, but they also play a part in the vector control management. They do a lot of education to make sure that the environment is clean, make sure the environment really propagates a healthy environment. So we've been working very closely with them, and they've been doing a really excellent job. So basically they fog as well, just like the vector control persons. They do the house inspections, but of course it differs from region to region, but they've been hand in hand with us.
Indeed, it's a collaborative effort.
Yeah.
So before we wrap up today's program, I want to talk a little bit about the severity of dengue. How severe is it, and what treatment is available for it?
Well, dengue can be very lethal. It can result in death. That's probably the maximum severity. But there's something we call severe dengue, where persons experience various symptoms. Some of them are like bleeding. Some of them experience severe fatigue, severe abdominal tenderness. Some of them may even have very low blood count and very low platelets. But of course, that would come following an evaluation from a doctor. But those persons, before these will become even very serious, you seek your doctor's care to find out where you are and how you're doing. And based on the assessment, your doctor would be able to refer you to a hospital to further care. I would advise everyone not to delay. Just go and see a doctor. Let them advise you. So that way we can prevent the worsening of your symptoms, so that it doesn't lead to a very little outcome.
Thank you so much, Dr. Niles. I want to encourage you to keep up the good work that you've been doing at your department.
Thank you. I just want to mention one thing. There is no specific treatment for dengue, but of course we do give supportive care within the health facilities, specifically at hospitals. But what we advise persons to do is basically prevent yourself from being bitten by a mosquito. So all that you can do, look at what we have on our Ministry of Health page. Prevent your family members, especially your young, vulnerable, and your old, from being bitten from the mosquitoes. So that's what my encouragement to the persons. Let us do our part, and together we will overcome.
Thank you for staying tuned to the Health Matters program. I'm your host, Alicia Martin, saying goodbye for now.